Hello, my name is Dr. Himanshu Dhawan. In today's video, I will address a common question from a patient. Is it possible to recover from varicocele through Ayurveda or a homeopathy? To answer this, I have some reports to show you. Please pause the screen to compare the before and after results. In these reports, you will notice that the patients had both varicocele and hydrocele. The follow-up reports shows that the varicocele has been resolved and is completely cleared. The hydrocele, however, was a mild and persists to some extent. When dealing with the multiple complications like hydrocele and varicocele, the treatment process can become a time consuming for any doctor. In this case, the hydrocele still persists because fluid retention needs to be addressed, which can be a slow process. If the patient has both hydrocele and a varicocele, sorting varicocele is a little easier than doing hydrocele. If the fluid in the hydrocele reduces to a mild level, it indicates that it may eventually dry out. But before that, we have to work on the reasons behind that lead to the development of both hydrocele and varicocele. That reason could be because of your constipation, your lifestyle activities, or some other problems like increased abdominal pressure, poor blood pressure, circulation, infection, or any inflammation in a scrotal area, and some physical trauma and injury to your groin area. Solving that reason is also a priority. This particular patient's recovery took approximately 3 to 3.5 months, which is relatively quick for a varicocele recovery. Initially, the patient had a varicocele grade between 2 and 3rd, but now where hydrocele and a new things has been detected in them, which is the epididymal cyst, and epididymal cyst is a cyst on an epididymal layer. So now the treatment approach for an epididymal cyst is different from that varicocele and hydrocele, which can take further time to recover from such complicated situations. But the question inside the patient is whether we can recover from varicocele with alternate medicines or not. So my answer is yes, because we have a cases that has showed good recovery even in complicated conditions like the one I have just discussed, because conditions can vary from patient to patient. Now with the patient, I told you about a treatment of 3 months. But I also talked about many such patients who took 6 months or 8 months or even a year. So the duration of time is something we cannot decide. Suppose your symptoms are getting calmed down, or you are feeling that there is a difference in the symptoms. You are getting relief in a pain, side by side nerve are looking less swelled, and the hanging is a little less. If you are seeing any such signs, positive signs, then it means that it is in a recovery stage. If you have been taking such medicines for a year and you have not had any test done in between, then it means there is a slack somewhere in your treatment and it is not known. So what I can recommend here is that if you haven't had any test done for the whole year, you must please get tested. If you get tested in between, then the test can show the recovery of you have. If the test result shows some reduction in 2.2 mm or 2.5 mm and the refluxes is not visible in your report, then it means the recovery has been done. But due to the diameter of veins which has lost elasticity, it taking time to come back to its original size. Apart from this, your body is recovering. It is putting it at the stage of self-healing. It will normalize itself with the self-healing. In that meantime, if you want to get further tests done, you can have a semen analysis test done side by side. It will solve your queries related to your fertility also. So that was all for today's video. If you understand the video, like it, think that it is possible to recover from varicocele naturally, then share this video with your friends and family or anyone who can get benefits from this information. See you in the next video. Till then, goodbye.